continuation of the disc herniations and healing times, with all the accidents that we deal with. There's even if the herniation was there before the accident, there's going to be some sort of, we'll just talk lumbar spine. There's going to be some sort of lumbar disc herniation more than likely in a lot of the patients. And I'm just going to talk about like healing times today, because that's of course, the biggest thing that people want to know is, well, how long is this going to bother me for? And if they've talked to other people in their life that have had some sort of disc injury, they may not get a very nice story from that family member or neighbor or whatever about their disc herniation, or someone they know who had disc herniation. So we always have to try to help people keep these things in context and help them understand that they do heal, and the overwhelming majority of disc herniations do not require any sort of intervention at all. And a lot of times you'll see people rush to some sort of intervention because the pain is real. That's unfortunately when disc herniation is sensitive enough, people are going to have pretty severe levels of pain, or they can have pretty severe levels of pain. And a lot of times it's not so much the back; it's like their leg or their foot, that has that pain involved, that becomes more difficult for them to manage than just like some low back stiffness or something like that. So, just the difficult part though is helping them realize that pain is going to improve, and the more things that they try to do to it, the more difficult a lot of times it becomes, or the longer the timeline becomes. Because if there's a irritated sensitive disc, and then a few weeks into it, we're doing some sort of injection therapy, which are recommended sometimes depending on the situation. We're introducing another irritant to the area, which is meant to reduce inflammation, but there's always that chance it's just going to cover up symptoms for a while, and the patient's going to feel good a lot of times, but then these aren't things that are long-term solutions. And people will continuously try to do more and more things in the beginning because of how much pain they're in. So they, of course, I'm in pain. Hello, everyone. I'm in pain. I don't want to be in pain. So it's hard for me to hear from you that, hey, 6 months from now, 12 months from now, this disc is going to be healed up, and you're probably not going to have pain anymore. Or within the first few weeks, you may not even have pain. And to get somebody who's struggling with some sort of radiating symptoms to turn around and stay the course and trust that you're telling them the truth, that this is something that will get better, that's going to heal over time, and shouldn't be something that they have to manage forever. Of course, surgical interventions, if people are experiencing pain that is intractable, it won't go away, or they're starting to have severe motor symptoms, muscle wasting, things of that nature, bladder and bowel function problems, then yes, we need to intervene a little more aggressively, because those become more serious issues. But if we're just talking about like pain that's in the leg or foot, that is something that's going to get better. That disc will heal eventually, and so there's as much as pain bothers a person and interferes with their life, it doesn't necessarily require really invasive management to improve. So, helping a person understand that this kind of injury is new to them. Hey, we're going to stay conservative. We're doing the right things. Physical therapies, exercises, maybe some anti-inflammatory medications are still the most tried and true ways to help people with non-surgical disc problems to heal. You'll probably feel better within somewhere in that 6 to 12 week time frame, and the disc itself does undergo healing and restructuring after herniation. It's just the timeline is very long, so there is there's the chance that you have flare-ups and things like that throughout that first year after the incident. And you have to really be cautious about how how aggressive and how invasive you treat even when symptoms do come back, and helping a patient realize that, hey, the healing process will take time, but it's nonlinear, and just getting them to be okay with the fact that they may go, they may have a nice steady improvement, have some setback that might bring them down even close to the pain they were feeling in the beginning, but then start climbing that ladder of healing again, and maybe another setback, and they might feel good for months and then have a brief setback. So just helping them stay the course, keep in mind that it's going to improve, it's going to heal, and just make sure that they're trusting the process and that they don't get too caught up in their own thinking about the problem, and then the the bad stories they might be hearing from others. So keep all that in mind, and talk to you guys later.